All right. What's going on, you guys? Welcome back to the Mindtality podcast. I'm your host, Rodolfo Felix.
And co-host Eric Ogaz.
And as you can tell, we do have a special guest. Mr. Kerry, you want to say hello?
Good morning. This is Kerry Gott. Nice to meet you all.
All right. Before we jump into this podcast, Eric and I just want to give you guys a quick rundown of our week. You guys, I got in my first car accident of the year.
What?
Remember when I called
Of the
you, Eric?
year?
Yeah, of the year. It had been maybe in 2 years. I don't think I've been in a car accident in a long time. I had just gotten off the freeway and I was going to make a left, and I was at the red light to make a left, and the windows are down. I'm taking my dog Louie to the vet. So his head's out the window. My head's out the window. We're listening to music, and then out of nowhere, just boom, I get whiplash. And me, the titri that I am, I'm like, okay, maybe I pulled the e-brake, maybe I pumped the brakes. And then I'm like, wait, it's not my fault. So I look to the corner of my left eye in the rearview mirror and see a guy coming out like, oh my God, an older gentleman who, well, I must say had the best swag ever. He had like a fedora with like a Puma jumpsuit, like a suede one. And it was an older gentleman. He was drooling from the mouth, and he was like, oh, I wasn't paying attention. I was on my radio. I was kind of like, my adrenaline was up there. So I was angry a little bit, but not really. And I just told him like, just give me a second. And I went to look around the back, and fortunately, thank God, there's no damage to the vehicle on either end. So it was he was driving like a 90 something like Toyota Camry, just like a very small car. So it must have like went under my bumper, because I drive like a Sentra 2017, so it's a little bit bigger than the older cars. I cut the guy a break. I didn't get any of his information, but man, Eric, it surprised me because one, I don't get in car accidents ever, and then two, I didn't even expect it. You know what I'm saying? It really shook me. I thought about it for a second. I was like, man, this is crazy. I had no clue. I had no clue what had hit me. And it gets worse, Eric. Kerry. So I get to the vet, and I'm on the phone with my fiance. I give her a call. Hey, babe, I just got in a car accident. I'm okay. There's no damage to the car. As I'm talking to the phone, Kerry, I see an older person reversing in the parking lot at the vet, and they're reversing, and they're
Is he driving a Camry?
No, a truck. And boom, off goes the headlight. They hit a pole to the point where the pole went like under the trunk of the truck. So she couldn't even put it in drive. Like, that's how bad she hit the pole. And I told my fiance, I was like, babe, I got to get home. I'm the kiss of death. Like, everything around me.
It's not your day.
Yeah. So I told her I need to get out of the way. But that was like to start off the week. We did the podcast last Tuesday. This was like Wednesday. And so my week was crack-a-lacking early on. How about you, Eric? What'd you get into this week?
Wow, I don't know if it's anything compared to that. That sounds like a script out of Final Destination. Like,
I'm telling you, this was in a span of 20 minutes. Like, this wasn't even like the full day.
Dang. Well, mine wasn't as eventful as that. It was just a typical work week for me. I've been working. It's my second week now at my job at the restaurant.
Yeah.
Doing well. I'm starting new positions already. I got like 4 different positions down, so that's a good thing. Learning it back. There was a moment though. I think it was not yesterday, but the day before, when I had just started my shift, and like it was the day of the Kentucky Derby, by the way.
Okay.
And just had to throw that out there because I was watching it right before I started my shift. And so like when I had started it though, I was a little bit scatterbrained. Not gonna lie, I was receiving orders, and I'm like looking at them like, oh, I was second guessing myself, like table 21, that's there. Okay, here, you want the chicken soup? Oh, I got broccoli. Okay. And then it was just like I kept,
oh my goodness.
Yeah, I had to set myself back and be like, okay, like, all right, figure it out. And then eventually I picked it up and got it. And then yesterday I came back strong and I was solid. I was on my game, and like it was good. But like that was key for me. It was being able to bounce back from like some of that is essential to my week that was this week. So that was something that was good. But anyways, we're not here to talk about us, are we, Rodolfo? We're here to talk about our guest speaker that we have today.
Indeed, definitely. So if you don't mind, Eric, I usually pop the first question. Kerry, introduce us. What city did you grow up in? What schools did you attend? Just
Sure.
kind of give us a little introduction of yourself.
Yeah. Well, I'm a California native. I was born in Sacramento, and then my family moved around several different locations in California when I was young. And then one of the highlights of my young life, I moved up to Montana for a year, which was great because we were outdoors hiking, camping, fishing, every weekend, including ice fishing, which is really awesome if you've never done that
Ooh,
before.
ooh.
Driving your
sounds-
truck out in the middle of a lake and, drilling a hole and fishing. Then I moved to Omaha, Nebraska, and that's kind of where I grew up. I was, high school in Omaha. And then I decided to be a marine biologist, which is really hard to do in Nebraska. So I got a scholarship and I went to University of Tampa in Florida. Got down there and kind of find out there weren't so many jobs available in marine biology. And a really great professor, Dr. Walker, said, you should become a physician. And I thought, well, I never really thought about that. My family's been in construction. So it was a novel idea, but I pursued it and I went to eventually UC Davis for complete my bachelor's degree and then UCLA for med school.
That's
Nice.
awesome.
Yeah.
Nice.
I did a residency and a fellowship and then started a practice in Southern California. And I've been practicing medicine for longer than I can remember.
You never looked back. You just listened to the professor. You said, yes, sir.
Yeah, what the heck?
Yeah. Yeah, it was really a big shift in career planning. But that's one of the things I talk to my kids about too. My kids were in high school and planning for college and trying to decide what they want to do. And there's a lot of pressure on young students now. It's like, what are you going to do? What are you going to do? What are you going to do? And I think young people should have an idea. They should have a goal and they should strive and work toward something that is attractive to them. But I told my kids, I said, you're going to get out there and you're going to discover things you've never seen before.
Yeah.
So feel free to pursue a passion. It may be something that I never introduced them to, or they've never heard of before. But if they shift gears and they go in a different direction and they love it and they're passionate about it and they dedicate themselves, and that's fantastic. So that's kind of what I did anyway.
Yeah, that's key to finding and leaving that open, right? Because life is very not guaranteed as far as that's concerned. And whatever you put your mind towards, like, you're probably going to shift 4 or 5 different times. I mean, I think the average freshman in their college changes their degree like 3 or 4 different times.
I know I did.
Yeah, I did too. I did as well. I was sports management, then I switched it to criminal justice. But it's all about finding your path, because you go open doors and you find that some of them are closed once you've opened it, and then you continue and you stop at a certain point, right? Then you're like, oh, this door interests me. Like, let's see what that door is about. And that's where you go about finding what works for you and what you're comfortable with. Because think about the end of the day, right? Because you're going to spend pretty much the rest of your life doing this profession, so you want to make sure that you love it and you're enjoying it, and it's not a job, it's something you love to do.
Yeah, but I can also see people being criticized. There's another side to that. Someone might look at that change, that career redirection, and say, oh, you're quitting, you quit, it was too hard, why are you giving up? And I would look at it a little differently. I say, if you stop doing something and you sit on your behind at home watching TV, you quit. Okay. But if you work really hard in a new direction where you have passion and you put a lot of energy and effort into it and you strive to move forward, that's not quitting. That's just kind of rerouting. I don't think there's anything wrong with that.
Absolutely.
Yeah, I agree 100%. But I wanna get a little bit more into it, Kerry. Was there at any point, whether it was studying your undergrad, studying your doctorate's degree, your residency, was there any doubt? Like, did you ever feel like man, I'm not sure. Like, I don't, like, was there any of that point, whether it was your first shifts on the job, or was there any point where you just kind of doubted and you just were weren't quite sure if this is what you wanted to do?
Well, once I got into medicine, med school and training and so forth, I never doubted my decision because I thoroughly enjoyed it. I
Okay.
loved it. But the workload is intense.
Definitely.
And there are times where you think, how can I do this? How can I keep up? Why does it look easier for other people? And I'm really struggling. That requires a little bit of perspective. No matter which walk of life you're in, there are going to be people who are better, more skilled, more experienced, who seem to handle it very easily compared to how you perceive yourself going through that project. So it's good to have perspective. Every time I think, you really struggle with something, you can look back on accomplishments that you've had where you have been successful and realize, hey, you know what? 10 years ago, I never thought I would accomplish this, but look, I did, because I walked through it step by step, and I was diligent and I persevered and I succeeded. So when there's a new journey ahead of you, you can always look back and say, well, how did I handle the last journey? Because I succeeded,
Right.
Yeah.
One step at a time. Some things can be overwhelming, but if you just take a step at a time and realize your small accomplishments along the way,
Yeah.
it's reinforcing.
Well said. Well said. And honestly, Kerry, you could have fooled me. I thought you were the best there is, plain and simple. Best doctor out there. I mean, every time we go on family vacations or even just an event, I always see you bringing your computer with you, and you're on it. You like to stay updated. You try and keep your mind thinking and fresh. So I always love that, like, part about you is that there's never like an off switch. Like, it's a great time to your work. You're trying to do it 110%, right?
Yeah.
You're not just in this profession just to put in your clock in and clock out, right? You're taking it outside of your work, and you trying to be better than those people that you say that have it naturally, right? So they have that advantage, but you have your work ethic advantage.
Yeah. Well, that's a double-edged sword too. Sometimes family members don't appreciate that.
I'll tell you, I appreciated it.
But along that line, because I think you, in a lot of professions, certainly in medicine, I think you really need to be humble, because a good doctor is someone who knows what he or she doesn't know. A dangerous doctor is someone who thinks he or she knows it all, because none of us do, and we're often humbled, and we learn from our patients. So that's why I'm always striving to learn, because I haven't figured it all out yet. It's a continuous learning project.
I like that. That was very well said. I really like that. I'm starting to see a little pattern here. Like I stated earlier before we started, a pattern starts to form. You mentioned taking things step by step and not getting too overwhelmed with the process. And from my understanding, Kerry, correct me if I'm wrong, Eric, you too. I think the trick is just being in the present, not trying to foresee things too far out, not trying to like have all the answers right away, but you just take things as they come and you excel at it to the best of your ability, and then you just continue that mentality of just like present, like I'm gonna do the best I am as a student, I'm gonna do the best I am as a intern, I'm gonna do the best I am as a professional. And like you said, you just remain humble, you focus on the present. And you guys, I know this is weird, and if you don't think that Rudy's weird, Rodolfo's weird, this is the wrong podcast. I'm weird. When I hopped out the shower, I was drying off, but I was like, how do I say this? I was drying off, not just like kind of like aimlessly, but I was drying off, you know what I'm saying? I was playing, just drying off. And I was just thinking like, this is, what is it called? Like, this is relevant to life, is like, don't just do things, but do things like, with purpose, like focus on what you're doing, be in the present, whether you're cleaning the restroom, be in the present. Whatever it is, you're working on a project, be in the present. Because if you start for like thinking, like maybe Eric, when you were struggling with your orders, maybe there was a lot of headspace, you're thinking about a lot of things, but it wasn't until that following day when you were purposely focused on what you were doing, that's when you had a better day. is there some truth to that, Kerry? Like, is being in the present like the key to not burning out, not exhausting yourself?
I think so, and that reminds me of another thought that I've shared with my kids. And um, being in the present means kind of mastering what's in front of you at the moment. And a lot of times people start a new task or a new job or a new career, or they start school, and it seems overwhelming because they're a novice, they're a beginner. But being older, I look at that and I say, that's an amazing opportunity, really. I mean, what a luxury to be a beginner where nobody holds you accountable for everything.
Yeah.
It's a really golden opportunity to say, you know what, I don't know how to do this. Can you help me?
Yeah.
If you've been doing it for 3 years and then you say, I don't know how to do this, can you help me? Shame on you. You should have known by then. But when you start something as a beginner, it's like this amazing opportunity to just soak in all the knowledge and ask everybody from their experience how they can guide you. And so instead of being intimidated by a new opportunity or experience, I think it's an amazing opportunity. I'm starting to get into woodworking. And I don't mind asking questions. I'd rather ask a question, learn something than, cut my finger off or something like that.
Yeah.
So being a beginner is a wonderful opportunity.
Absolutely. What the expression I like to use as well is when you get like something brand new and you said the overwhelming amount of information, it's like trying to drink out of a fire hydrant.
Yeah.
True.
So that but it's good though, like, right, because it's the exposure, you have the opportunities in front of you, right, and you're taking on step by step, being in the present, and be like, okay, this may be like an overwhelming a lot in the overall picture, but what if I just read 20 pages per day? Well, that's 20 books per year. Or if I save $10 per day, that's $3,650 a year. Like, or even run 1 mile a day, that's 365 miles. Okay.
Yeah.
That's just the grand scheme of things. It sounds like a lot, but if you just break it down to its fundamental roots, it is really obtainable. Really, it is.
It is, yeah.
And then if you get really that's 100%. We'll just leave it at 100%. But if you really want to go 110%, you read that 20 pages per day, then you read an extra 10. Right?
Yeah.
That's when you really want to
realize it's doable. It's not that hard.
Exactly.
Yeah.
Exactly.
It's true. Like when you chip away at something and like we're talking about, just being in the present, just taking care of it as it comes, looking back, it's like very refreshing. For example, I just did the math here. Our podcasts are typically around 40 minutes. I did times 21 because today's the 21st episode. Eric, this is 840 minutes of podcasting. And it doesn't even feel like that, but because you chip away at it week by week, you're consistent. You start to develop this experience, you start to develop this type of resume that you develop. And I don't even dare, Kerry, look at the beginning of like the first videos we dropped. Forget about it. I do not want.
Yeah, there's a learning curve, isn't there?
It's so cringy. So it's like like, why did I say this? Why did I post this video? No, but it's definitely that learning curve, and you can't have that refreshing moment if you're constantly like critical, or you're constantly like dwelling on the past or concerned about the future. But when you just kind of like you focus on how can I improve today, it starts, there's that learning curve. It starts to develop naturally.
Yeah, you mentioned being self-critical. I think it's human nature that we tend to focus on the negative, or the negative things hurt us more than the positive things make us feel good. And that's actually been studied in finance and investing. But I think it's true in other aspects of life too, and in knowledge. I mean, for me anyway, I don't value what I know, but I'm disturbed by what I don't know. So you can kind of be impacted more by the negative than you are rewarded by the positive. And you just need to sort of think through that a bit and appreciate what you have learned, what you have accomplished, or the friends you have made, and focusing on the friends you don't have, for example.
Right.
I think it's human nature, but it's important to recognize that.
Definitely. And I kind of want to, great, first of all, wise words. I appreciate all those
Can we
words.
just talk about that, Kerry?
Yeah.
Do I cry now or later? Because I have
whenever you're ready.
I got all your quotes right here. You think I'm messing around? I got all your quotes right here. I'm sorry, Eric. Go ahead.
Yeah, so very wise words. We appreciate you having you on this podcast, but I wanted to kind of go back into your profession a little bit and talk more about that. I don't think we mentioned it. What type of physician are you? Like, what do you specialize in? What area?
Yeah, so I'm an internist, and I did a fellowship in infectious diseases. So that's my specialty, is infectious disease, and I still practice infectious disease, but over the last 15 years or so, I got into chronic wound care, healing, and hyperbaric oxygen therapy. So I run a wound care hyperbaric oxygen program at a small rehabilitation hospital.
Awesome. And what led you to that path? Yeah.
Well, so as an infectious disease doctor, I was frequently called by my colleagues, and they had a patient with a wound on their leg, for example, that wouldn't heal for weeks and months. And often the doctor would treat with one antibiotic or a different antibiotic, another antibiotic, and it wasn't helping. And so then they would call me and say, I've treated this patient, it's not getting any better. Which antibiotic should I use next? And the answer was none.
Oof. Okay.
It's not an infection, it's a wound. And I realized that in our community at that time, there wasn't any physician who was specializing in wound care and recognizing the different causes of wounds. And so I kind of said, well, I need to learn how to do this. And then I developed this wound care program. And so that's kind of the route that it went. There was a need. I recognized the need, and I was being called on it. So I rerouted, I shifted gears, I learned something new. And now that's what I do full time.
Wow.
I love it.
Yeah, that's awesome. So as far as, okay, so you probably then see a lot of nasty stuff then when
that's
you're
what
on
I'm thinking. I automatically thought about pus and green stuff.
Yeah.
So you're right. So I'm desensitized to it, I guess. But there are patients out there who have this need. Unfortunately, there are patients who get their foot run over by a forklift, or they're in a bad car accident, or they have diabetes and they have an amputation, or I can run through burns. There's all kinds of different wounds. But as a physician, I want to fix things. I'm a fixer. So it's like, okay, how can I fix this? I gotta make this better. And so I don't look at it as, oh my God, it's an ugly wound. I look at this poor patient. I mean, they have to live every day with this.
Yeah.
Right.
So how can I fix this to make it better and improve their quality of life?
Right. And so that's a great way of looking at it as well. And outside of work, though, I'm sure it probably might take a toll on you. It may not now. You might become desensitized by it, but I mean, I don't know if I would be able to eat dinner after a day of work. So outside of work, how do you reset your mind so that going into the next day, you're focused and you're 110% to be able to treat these patients with these infections or wounds?
Well, everybody should have interests and hobbies and passions they can pursue that kind of rejuvenate their mind and body a little bit. I tell you, I was going to say, well, I'm a runner, but I'm not anymore.
Me too. Same here.
I used to be. I did a couple marathons, I did triathlons, but I just kind of got sidetracked really with work. I'm starting to develop a hobby of woodworking, and I'm starting to educate myself a little bit about welding. So I have a couple of things like that I'm looking into. I ride motorcycles in the desert once in a while, and I have a Jeep. We do some Jeeping. But aside, I don't think that's what you were asking, but I better tell you, one thing I've learned over the years, sleep. You got to get your sleep.
Hate that word.
Because I was sleep deprived, a good part of my life. But I can tell you, your mind and your soul and your body and your emotions and your ability to care for people around you is so much better if you get good quality sleep.
Do
So
you,
that's sort of a side note,
And
but
yeah.
it's
I sh-
experience.
I just want to say before you, Rodolfo,
Yeah, go ahead.
this is a doctor that is saying sleep is essential. So,
What?
all right, go
Well, now
ahead.
they say you'll live longer if you sleep at least 8 hours a night.
Uh,
Actually live longer.
you're breaking my heart here, Kerry. Kerry, I know you're a wound specialist. You're not a psychiatrist or anything. Do you feel like there's some type of correlation between like lifestyle and sleep? Do you think like um your focus, like it sounds like your focus like in just getting your amount of sleep, like you're dialed in, like it's a priority. Do you feel like what are some things people can do to prioritize sleep, like besides the obvious, put the phone down before like bed? You don't need to spend an hour on your phone before bed. Like what do you like what are some things you do, I should say, that helps you prioritize sleep?
My wife.
Yeah.
She has very good sleep habits, and she
Okay.
decided a long time ago, why should I drag myself through the street, exhausted, sleep deprived?
Hmm.
I'm better than that. My life is more important than that. My body is worth more than that. And so she prioritized sleep. And so she taught me to prioritize sleep. You look at all the other things you do in your life for yourselves or for others. You work to make money. You hopefully eat healthy to keep yourself, in good shape, and you work out and you run, and then you trash your body by not sleeping. It really doesn't make sense. So you just have, I think if people, do a little bit of research and understand the value of sleep, your mind recovers when you sleep. Your mind refreshes itself and rejuvenates.
Mhm.
Once you learn that and understand that, how can you deprive your body of that? You wouldn't deprive your body of food and starve,
Yeah.
and
Mhm.
so sleep is a critical part of our normal physiology, and we need to respect it.
I remember reading somewhere, I don't know if this is true, you may have to correct me on this, Carrie, but like if you right before you go to bed is the perfect time to study for something, because when you study something, when you read it, then you close your eyes immediately afterwards. You're thinking about what you just read and what you just studied, right? And your mind's going over. Even if sometimes you might even consciously not be reading and going over it, you might be subconsciously doing it as well. So in addition to getting your sleep and your body preparing itself, it's also working on your mind, right? It's your mental.
Absolutely.
Your
This is well studied, and I'm not an expert and I can't describe it in scientific terms, but you're absolutely correct. It's like when you study something, you put these little building blocks in your brain. Okay. And you can open your book and quiz yourself and think, okay, I kind of know that. You really don't know it very well. But when you sleep, your brain takes those building blocks and rearranges them and puts them in a format that's much more solid. And so that memory becomes much more permanent. I forget the term they use for that, but it's true. Then you actually learn something in a much more meaningful way. And so you really should study hard, sleep well. I know how it is in college. I did it too. Did it in med school.
Yeah.
You get 2 hours of sleep and then you go take an exam. That was the worst thing to do.
Yeah, definitely.
Really.
Horrible.
So
Horrible.
yeah, sleep is a critical part of learning. Absolutely.
This is this just testifies, you mentioned earlier how your perspective was shifting a lot when you were studying, how why does it look so easier for them? Why is it so hard for me? And then you said how you just took things as they came, and that was equivalent to like their natural ability to excel. When I hear you say things about prioritizing sleep, this is another behavior that supports the what is it? Hard work over talent type of idea.
Yeah.
Is because you can have talent, you can have that natural ability, but if you have a shoddy sleep schedule and you don't prioritize your mind.
Mhm.
That person who may not be as skilled as you, but has their priorities straight, has those behaviors, they're gonna outwork you. It's
Yeah.
there's only so much your body can do. And that just goes to show you guys, you can have the gifts, you can have all the bells and whistles, but if you don't have that discipline, you're gonna fall behind. The guy's coming right out. He's right behind you.
Yeah.
Yeah. And I think too, Kerry has some talents as well. He may be discrediting himself or keeping himself humble, but he's very intuitive with his when he thinks about things and comes up with solutions to a lot of problems that nobody really understands an answer to. He's able to be intuitive about it, whereas others may not be able to think about that right away. So, whereas others are, knowledgeable and talented in that aspect, Kerry's he's still talented and everybody else is still talented. It's
Mhm.
just finding what your talent is.
Yeah.
Yeah. Well, and kind of related to that, Eric, I've been struggling through a few things in the last couple of years dealing with trust and estates and loss of family members. And those are struggles that, at my age, I was never prepared for, and I never thought I'd have to deal with, but I'm learning so much in the process. I was talking to my mom about it. I kind of enjoy that I've learned so much, and I can share that with someone else. But one of the main lessons, still even at my age, is I can problem solve. I
Mhm.
may not get it right the first time. I may not get it right the second time. I may get frustrated. I may be humbled by my ignorance, but I'll keep working at it
Yeah.
and problem solve, problem solve, problem solve.
Mhm.
Eventually I get through it and I get it figured out.
Right.
Kerry, can you walk us through what a typical work week looks like? I love hearing other people's schedule, because it kind of inspires me to kind of push through my schedule. Because I know, like we mentioned earlier, everyone's schedule's hectic, not everything works out. What's a typical work week look like? Does it rotate? Do you have a set schedule? How many hours do you put in typically?
Yeah, so I've actually created a more comfortable work schedule than I used to have. I used to work almost exclusively in a hospital, and I had long days and many weekends on call. But that's evolved, and so now I have a much more comfortable schedule. So I see patients from 8 in the morning till 6 o'clock in the evening, and there's a lot of paperwork and computer work involved in that, in addition to actually seeing the patient. And that's all hospital based. So my wound care program and hyperbaric medicine program is in a hospital. I don't have my own office. I work in the hospital exclusively. And I've been really fortunate in that regard. The hospital's been very supportive, and I have amazing staff to work with. So I see patients all day long. And then often I have to manage my solo practice. So there's all the business aspects, accounting and bookkeeping and billing and contracts and that sort of thing. So I do that kind of work on early mornings, evenings, or weekends. But in terms of my actual clinical patient care, it's kind of a, 8 to 5, 8 to 6 job, Monday through Friday.
Nice,
Yeah.
solid.
But I built that because I got burned
Yes.
out.
Yes.
I got burned out of being on call and working, 16-hour days.
Yeah, that reminds me of me right now. I do a lot of overnights, Kerry, and it sucks. I got my BA in sociology and social work, and so I work at a homeless youth shelter
Mm-hmm.
for county dependent children and for runaway and homeless youth up until the age of 17. And I work a lot of overnights. It sucks, but part of this podcast, which is an acronym, the TMP, the Mindtality podcast, is the documentation that happens week by week. We document. We last week we acknowledged the fact that when we started this podcast, Kerry, Eric was finishing. He was on his last semester of his undergrad, and boom, now he's done. We have that documented week by week, just kind of showing like that, hitting the same spot of the tree over and over, and that tree will fall type of deal. And that's what I kind of want to do. I want to give this podcast a shout out because we're almost done here. I just wanted to thank you, Kerry, so much for being on the podcast. You were very wise words. I have to go over these sticky notes because man, I was like, what's going on? This guy's just dropping heat on us. But yeah, like to my point,
I guess that's good, right?
Yes, heat is good. Heat is good. I just wanted to say, like, kind of like you were on call, your schedule was kind of shoddy, but you worked towards more of something that kind of worked for you. And I'm sure in the moment it felt endless. You weren't sure when your schedule was gonna get fixed. And that's where I kind of feel I'm right now. I'm doing overnights, and then I have a swing shift. I go in the very next evening. And I know it's not gonna be forever, especially if I keep at it. If I keep at my career, things will shift. And that's why I wanted this podcast to have that documentation for people can see, like, not everything lasts forever. Like, your current occupation isn't your forever occupation, whether you love it or it's just the process. Like, you're not sure what you're going to do. Eric's starting law school in a couple months. It's just it's a process, and that's why I wanted to document it, because I know even for myself, one day I will look back, oh God, on these early videos, and I'll see that process. I'll see that transformation. And that is why I created this podcast. Eric, do you have anything you wanted to share before we end it?
No, just thank you, Kerry. We really appreciate it. Like Rodolfo said, very wise words.
Yes.
My pleasure.
So, all right.
Good to share experience, good, bad, or in between. We can all learn the lessons together.
Yes, definitely. And you're more than welcome to be back on this podcast. Kerry, thank you for blessing us with your presence, your wise words, and that's going to do it for this podcast. So thank you guys for tuning in. This has been another week at the Mindtality podcast, and we'll see you guys in the next week. Peace.